Amazing morning to you once again. Thank you so much for tuning in and joining us right here on Radio Doctor on Women Radio WFM 91.7. This is Nigeria's first radio station for women and their families. 13 minutes after 10 on this amazing Tuesday morning, the 9th day in the month of January 2024. Hope you're feeling healthy today. Hope you're doing great. Work is going on well. Well, if you're not feeling well or if you're in the hospital for one reason or the other, I pray and I hope that you feel better. So first of all, you need to abide by the doctor's instructions. You need to take your drugs regularly. You need to take care of yourself. You need to come for medical checkups as frequent as the doctor says you should. Do not joke with that. This year, no grief for any kind health issue at all. All right, anyone where you know say you feel deal with by yourself, no grief for her. Shugbo. All right, so yeah, this is Women Radio WFM 91.7. My name is Rose Yusuf Kaiser, and you're welcome to the program Radio Doctor. Radio Doctor is your free health consultation program where real doctors advise real people. All right, that's what we do on Radio Doctor, right here on Women Radio WFM 91.7. This is Nigeria's first specialized health program where medical doctors consult for free right here on Women Radio WFM 91.7. And of course, we also get to bring this program to you Mondays through Fridays from 10 to 11 a.m. where we get to look at different aspects of your health. So we have different days for different specialty on Radio Doctor. On Mondays we get to look at children's health. On Tuesdays we look at women's health. On Wednesdays, of course, general health, and of course on Thursday, elderly health. On Fridays too, we look at general health. So today, women's health is supported by ACT Foundation, and we have with us this morning our radio doctor for today is Dr. Edopolo Osazua, a consultant obstetrician and gynecologist at St. Ives Family Hospital. Happy New Year, Dr. Osazua, and good morning to you.
Happy New Year.
Let me do shaka for you. Happy New Year.
That was Women Radio.
Yes.
Thank you very much for taking care of women last year.
Oh. Thank you for being a part of the taking care of women. All right. How was the Christmas celebration? How's the New Year celebrations for you?
It was fine. It was on work.
Okay.
We had some deliveries on Christmas Day, which was fine. So
oh wow.
Give birth to some people that look like Jesus Christ, which was good.
All right. Oh, that's good. That's good. Congratulations to them. All right, Dr. Sazoa. So we are going to continue from where we stopped last year with you, talking about STIs. All right. So today we're going to be looking at chlamydia testing, treatment, and care. All right. So that's a topic that Dr. Sazoa will be consulting and advising on today. Chlamydia testing, treatment, and care. So let's not forget I say Women's Health today on Radio Doctor is supported by ACT Foundation. All right, so to be a part of the program, you can dial 07000 917 917. Send us a text or a WhatsApp message to 070 317 56537. All right, you can also log on to our social media, Facebook, Instagram, X, and of course YouTube at WFM 917. Download our mobile app WFM 917. Log on to our website www.wfm917.com. All right, so chlamydia testing, treatment, and care right here on the Radio Doctor, your free health consultation program where real doctors advise real people. All right, doctors, as well, let's get on to it. So when we say chlamydia, let's even understand what this STI is, all right, and how it affects women before we come to looking at symptoms and all of that. So what is chlamydia about and how does this affect women?
Thank you very much. Happy New Year here in Lagos. I want to talk about chlamydia. Chlamydia basically, the full name for chlamydia is Chlamydia trachomatis. But it's a form of sexually transmitted disease. You know, we'll be dealing with all the sexually transmitted diseases, the recent, the gonorrhea, the chlamydia, the syphilis, and co. But chlamydia is a bacterial infection that is caused by Chlamydia trachomatis, and it's a very common sexually transmitted infection. So it's sexually transmitted, i.e. can be transmitted through any form of sexual intercourse, either by oral, either by vaginal penetration, or either by kissing. So they can be transmitted through sexually transmitted disease. Sometimes we refer to this chlamydia as a silent infection because most people do have it and they have no symptoms. And it has been found that it commonly affects people of age under 25 years of 25 years of age who are regularly changing their partner. We can say that chlamydia belongs to some form of organisms that usually affect this, the cervix, the womb, and as well as the fallopian tube. They can get as far as affecting the liver as well as the kidney. And there are different types of chlamydia that we want to go into that one, but there are different serovars of chlamydia A, B, D, K, L, Y. So I don't want to go into those ones. Now, what by way of telling us about the epidemiology of chlamydia?
Hello, Dr. Tazo, are you with us? Can you hear me? All right, so we'll just try to reconnect with Dr. Sazua this morning on Radio Doctor, and he's telling us what chlamydia is all about, how it affects women, you know, and just giving us all the necessary information we need to know on chlamydia. Now, this is an STI, all right, so, and he has mentioned different parts of a woman's body that chlamydia gets to affect. So while we'll try to reconnect with him so we can have him back join us quickly right here on the Radio Doctor. Do want to send your thoughts, your concerns, your questions on chlamydia testing, treatment and care to 070-317-56537. That is a number to send in your message, or you can also call us up on 07000-917-917. The doctor is here, and of course he will definitely attend to your concerns, your questions right here on Women Radio WFM 91.7. After all, this is Radio Doctor. This is your free health consultation program where real doctors advise real people. So do you think that you've been affected by one STI or the other, and you think that, oh yes, I think this doctor can actually help me today? Please do well to call in. Let's get to hear from you. 07000-917-917. Send us a text or a WhatsApp message to 070-317-56537. All right, this is Women Radio WFM, and of course this is Radio Doctor, your free health consultation program where real doctors advise real people. Today we have Dr. Ede Otokpolo Osazua, consultant obstetrician and gynecologist at St. Ives Family Hospital, talking to us about chlamydia testing, treatment and care. All right, so let's see, Dr. Osazua, do we have you back? Are you with us?
Yes. Can I continue?
Yes, please go ahead. Go ahead.
Okay, thank you very much. Sorry for the break in transmission. Internet, our network issue. So basically, now more than 1 million people are affected with chlamydia trachomatis.
Wow.
Let me say that chlamydia is more common than gonorrhea. We talk about gonorrhea, and about 40% or more are among the Africans. So American female is also aged between 18 to 26 years, also have chlamydia, and some people, also children, are exposed to chlamydia infection. About 100,000 units are exposed to chlamydia infection every year. So basically, chlamydia are asymptomatic. Because of that, when people acquire the infection, they don't know until all the damages are done. So let me quickly talk about who are the people that are more affected. Now, the whites are also affected more often. People who have multiple sexual partners are also more affected, or immune sexual partners. Age between 15 and 24 years, less than 90 years, are more affected. People who live in poor socioeconomic conditions, people who are homeless, are also affected to some extent. People who also exchange sex for drugs, some people go and exchange sex for drugs, and they tend to be affected. Single marital status are also at risk of having chlamydia, and people who also have sex without any form of contraception are also affected. Some people too who have also said that who have had history of previous sexually transmitted disease before, or co-infection with other sexually transmitted diseases are also affected. While some who also have some background immune issues, okay, they are also born affected. So basically, we cannot say that even for chlamydia, having been a foster child too, also present these patients, also allow these patients to be prone to having chlamydia trachomatis. So those are basically the risk factors of patients acquiring chlamydia infection.
Okay. All right. Thank you very much for taking us through all of that and giving us an overview of chlamydia. All right, so thank you, Dr. Sozua. Now let's get to hear some of the common methods used to test chlamydia in women, because you said that one could have it and you wouldn't even know till the damage has been done. So that means, like you mentioned, it's they are asymptomatic. So what are some of the common methods used to test this? And okay, let's get to know the common methods used to test for chlamydia before we know some of maybe the symptoms that could be exhibited, some that we don't even maybe take note of.
I don't get you. Can you repeat the question?
All right, so I was just asking the common method used to test for chlamydia in women. Let's start with that first.
Okay, thank you very much. Before we discuss the common methods used to test for chlamydia, basically, there are the ways patients with chlamydia will present. Most of the time, as I said, they are not symptomatic, they are asymptomatic.
Yes.
But when they do have symptoms, they do present with some form of symptoms. One of those symptoms include they can have pain or burning sensation during when you pass urine, during urination. Patient can have low abdominal pain. Patient can have painful sexual intercourse, which is called dyspareunia. Some of these patients can have some become of discharge. The discharge is very different from the one that we normally see in Candida, which is usually white. So most of these discharge sometimes are usually purulent and they are foul smelling. Now, because the chlamydia can also affect their period will become irregular. As I see more for the not sleep again, they have one called sleeping between periods, which we call intermenstrual bleeding. Now, for the male too can also have one called testicular pain. That means pain in their testes, and this may end up coming way ahead to destroy their testes as they get a bit older. Some of them may also have, some people that also inject the rectal cavity, they have one called rectal bleeding. They bleeding from their rectum, and this can be very significant. So sometimes some they can also have pain at their joints, which we call arthritis. So they can also have pain at their joints, they will have what we call arthritis. Now, let me say before we go to diagnosis that genital infections with chlamydia trachomatis, patients can have arthritis, can have pain during proctitis in men, and women sometimes they can have infection of the fallopian tube, which is called capititis, which will finally damage their tube, and they will not be able to get pregnant again. But they can also have what we call inflammation or infection of the womb, which we call endometritis. So this can also have damage their womb. So they can have pelvic inflammatory disease, which are set off, and they now begin to have what we call chronic pelvic pain. And for the men can have what we call pain in the testes, pain in the prostate, and they have what we call prostatitis. But the mental transmission, sometimes this infection can be transmitted to their baby. Now, when you transmit this infection to the baby, the baby can come out and have what we call infection of the air, which is called ophthalmic pneumonia. And some they can end up having what we call baby liver with patient chlamydia can have what we call pneumonia. That means that they have a respiratory tract infection. And sometimes these conjunctivitis and respiratory disease that they have can result and they can progress to have some. They can progress to have what we call blindness, and they can also result to death. So we have to be very careful. People who get contaminated and directly exposure to female vaginal fluid infection. So basically, those are all the complications we now find in patients that have chlamydia trachomatis. That's why we say that, it's better to prevent it rather than allowing it to progress.
Okay. All right. So it's better to present it. Thank you so much, Dr. Sazua, for that. Now, how often should a woman get tested for chlamydia? How often should, we go to the hospital for this? Or should it also be the same with other STIs, or there's a specific timing for testing for chlamydia?
Basically, when we talk about testing for especially of the STI, they are actually different. For a patient that is an adult that is doing reproductive age, it's usually better for them to do at least yearly test for chlamydia trachomatis. And the way you do the test is there are different ways. For now, you can take swab. You can take from where the unicorn mass from, which is called the urethra. You can also take from the neck of the womb, which is called the cervix. And we'll do taking the rectum. And now do a culture for them. We also do what we call nucleic acid amplification test, which we do for this patient. If you come out to be positive, then it's better to treat this patient, especially if there's a risk factor.
Okay. All right. Thank you so much, Dr. Sazua. This is Women Radio WFM 91.7, and this is 29 minutes after 10. So do well to send in your questions or your concerns on 070 317 56537. Do well to also dial the number 07000 917 917. Those are the numbers to get in across with us, get in touch with us this morning if you have questions, you have concerns on chlamydia treatment and testing. All right, right here on Women Radio. Okay, so let's get on to ask the doctor more questions on chlamydia. Now, Dr. Sazua, how treatable is chlamydia in women? And what are the treatment options if this is actually treatable?
Let me say that chlamydia can be treated.
Okay.
However, if the complications are arising, the only treatment complication cannot reverse the complication. For instance, if the womb is already damaged, the repeated chlamydia infection, endometritis, and so cannot reverse it. But in order to prevent the complication to continue, so what we normally do is that for patients that are at risk of chlamydia, we normally treat them with antibiotics. And that we found that treatment with antibiotics are found to be very useful for these patients. And these are further advanced complications that they arise from chlamydia infection.
Okay. All right. Thank you very much. And how long does it take to actually treat and cure, treat chlamydia?
It's quite easy to treat. For if the diagnosis is made, there are two options. Now, where there are two antibiotics that are already available to discuss. I'll just mention it.
Okay.
Now, the doxycycline, we normally use them for 1 week to 2 weeks. If we are not sure that, the infection has gone further, and then the patient is after taking the symptoms of pelvic inflammatory disease, we can give them for 2 weeks, and it is doxycycline. Then the other drug we normally use for this patient is also called azithromycin. We can give a start dose of 1 to 2 grams. When you give them at once, usually most of the time they are fine. And you give or repeat test in another 1 to 2 weeks, and the patient gets to do very well.
Okay. All right. Thank you so much, Doctor, for that. All right. Do well to send in your questions and your concerns to 070 317 56537. This is Radio Doctor right here on Women Radio, and today on Radio Doctor is Women's Health, and Women's Health is supported by ACT Foundation, and the doctor is here advising and consulting on chlamydia testing, treatment and care right here on Women Radio WFM 91.7. All right, so Doctor, you mentioned that chlamydia could actually be transmitted, and you see the baby getting infected to the baby. So when we talk about transmission to a mother, from mother to baby, how does this happen and how does this work, and to what extent does this get to affect the child? Is it something that when the child comes out with you mentioned pneumonia and the rest, so could it be something that could be treated in the child too, or it could probably be a lifelong illness for the child?
Yeah, so most of the time, I think chlamydia is a very soft disease. So sometimes most of these patients will have chlamydia and you will not know. While most of the time, when they present with inability to conceive and you screen them, that's what I'm saying. Even for patients that also undergo IVF, in tissue fertilization sometimes, there is also that, some of them may have chlamydia infection that keep on inflammatory and having problem with conception. But when you treat, you will be lucky and get pregnant. However, when patient with chlamydia infection gets pregnant, nobody thinks that the fear is that, the chlamydia can cause the placenta and can affect the baby eyes. And during the course of delivery too, and when the baby comes to the breast, so some of those infections can get across to the baby. And when this does not get across to the baby, so the baby gets infected. And two things that the baby normally suffer from are, one, the baby can affect the baby's eyes. So most of the time, when you anticipate that there is an infection of the eye following delivery, first thing to do is to take a swab to be sure that the organ is not chlamydia. So if it's chlamydia, definitely the patient will be given benefit for treatment. Otherwise, if it's not treated, the patient can have what we call complications of chlamydia. It's called ophthalmic immunometaphyseal, and this can further damage the cornea of the baby, and sometimes can lead to blindness. So that's why we're very so that necessarily on towards the child from the baby's eyes. Now, this chlamydia infection can also cause some degree of infection that they affect the baby leg. Baby can come out and they have what we call lung infection, which is referred to as pneumonia. What we don't treat this in the baby, what we normally do is to ensure that the baby are adequately treated and screened for chlamydia before they are discharged. If not, we can have lung collapse, and what we have will be having baby early neonatal death.
Okay. All right. Thank you so much, Dr. Sozua, for this. Now let's look at complications of untreated chlamydia in women. What are some of the potential complications of untreated chlamydia in women? I know you've mentioned a few, but I want us to dwell on this for a little while, because you said this could actually be on, and a woman will not even know that this is happening until probably the deed has been done. So what are some of the complications that comes with untreated chlamydia in women?
A lot of complications are associated with chlamydia when poorly treated, especially in women of the pediatric age group, as well as men. Men are also affected. They also are used to having chlamydia infection complications. Now, we'll start from the problem of inability to conceive. So sometimes patients with chlamydia infection may not be able to conceive, which we call infertility. Now, what is things that normally cause this infertility to the patient? One of them is that, one, there can be infection of the womb. And when there is infection of the womb, that will become infected, okay? And that what we refer to as endometritis. So if the womb is infected, so there's a virus, and the womb may not be able to carry pregnancy. The person who has chlamydia and will have poorly treated chlamydia, that's why clinical may end up becoming infertile. Two, the infection can also affect the fallopian tubes. When they affect the fallopian tubes, that means all the apparatus of the fallopian tubes. And when this do happen, the tubes heal and they are blocked. So what would that mean that a woman who has a blocked tube may not be able to conceive because the tube is blocked.
Yeah.
If she has deliberately conceived, there's another problem that may happen. The patient can have what we call extrauterine pregnancy, which we refer to as ectopic pregnancy.
Okay.
When a woman has ectopic pregnancy, they know there's a risk of death following that. So the woman too can also have an offending infection that will according to the ovaries, and they can form what we call abscess, and this is what we call tubal ovarian abscess. So when this abscess, after localized collection of spores because of repeated infection, now when this happens, what happens is that the woman sometimes can have what we call very bad chronic thing. You have somebody that every time is having change, cannot do anything. So most of the time, you realize that if you have chlamydia or gonorrhea or have syphilis, when we talk about syphilis, because it's different. So they can have what we call abscess will not lead them to have what we call peritonitis. Peritonitis, which you have to go in and do a surgery for the blood abdomen to get free of the spot. So most women will not be able to conceive. They can have abscess, they can have peritonitis. Some of them too can also have ectopic pregnancy, which I said. And sometimes the infection can be so serious that it can move up. And at the end of the day, the thing may affect their joints, which we call arthritis, not arthritis. And most of them, they have arthritis. Then for men too, men are not so invested. Men also have what we call arthritis, right? They are passing urine, they are passing stuff in their urine. So they have what we call damage to their urethra. And when the urethra is damaged, some of them can have what we call urethral stenosis, or urethral narrowing of the urethra. So this one may not be able to pass through. At the end of the day, the end of having catheter to pass through from the abdomen. Some of these men can also have what we call anxiety, that they have pain and their bladder infected. Some of these patients can also have inability to conceive because sometimes their testes and everything are destroyed. So when the testes are destroyed, they cannot produce semen, not produce sperm, and when they cannot produce sperm, automatically they cannot also get anybody pregnant. So, and in children too, they can have what we call consumptive transmission. Some of them can also have what we call they can also have pneumonia. Then going back to the skinning too, the children can also have what we call pain during sexual intercourse, which is called dyspareunia. They can have what we call pain during party removal, which we call urea. Some of them can also have what we call fitting between periods, which we call intermenstrual bleeding. So it's better to avoid also take necessary precautions so that to avoid complications, because the complications are in this serious, and if you don't act on time, or if you don't leave the avoid a sexual behavior, the tendency that the patient will end up having this infection. Maybe an innocent person, being an innocent girl, would have a partner that has multiple sexual partners. Life is beautiful. Yeah. We need to enjoy our life, or there's no need for us to complicate our life. And that they can have this antibody can be produced soon, the immune response, and these are the found to also damage other immune systems, and the patient immunity can also affect it.
Okay. There's something you said that got my attention. Normally, when we mention chlamydia, it's always a woman that comes to mind. So are we saying that men also come down with chlamydia, and how is it for them too?
So men actually come down with chlamydia. It's very clever. It's especially chlamydia is anything that affects the woman also affects the man, because the experience that the chlamydia affects also affects it. So most of the challenges you have is that for men sometimes they will not seek any form of care. They will just continue living their life. Sometimes we have seen a lot of men who come here in this facility who has zero sperm or who has no sperm at all. They were trying to evaluate and find out what happened. But those people will not tell you what happened initially. They may have, some of them they have what we call particular pressure. Some of them have also have this chlamydia, which has chlamydia sepsis, and at the end of the day, when the sepsis is damaged, which nobody will know, and the end of the day cannot produce sperm again. It's just for my enlightenment now. You know, when somebody wants to get married in the church and everything, they do all the investigations, the blood group, the genotype, the blood group, genotype, what is the HIV, and everything. I think nowadays we should also be screening for sexually transmitted disease for the patient can have like chlamydia and gonorrhea and syphilis, so you know And that's so that it's even better for the men now. Although you don't want to entry, I know it's not easy, sometimes, but I think it's advisable now for people to reduce their stem count so that you don't want your entry. So it's even better for the men if you want to be very candid and very sincere and be a good person. And before you get married, do your stem count. So you know what to tell your spouse. Don't come and get married at the end of the year, not to do anything you don't want to do your stem. So when you know that you are telling your spouse, only you know you love your spouse very well, you have to tell her the truth. That, oh, you have to do problem, so that she will know and seek for help and seek for counsel. I think I will advocate and I will advise. But I don't want to keep our investigation, please, I want to complete medical investigation to HIV, hepatitis, and not people know. If possible, let the men begin themselves too. That because there is so much increasing rate of men in those countries today. And what will account for it is the Chlamydia or any of the sexually transmitted disease, which have damaged the testes at the end of the day, the man ends up becoming not able to produce any form of sperm. Rather than addressing the primary issue, they can't go from one analyst to another or one church to another and taking time. Go ahead and please.
All right, thank you so much, Dr. Sazo, for that. This is Women Radio WFM 91.7, and of course, you can do well to send in your questions, your concerns, right here on Radio Doctor. The number to call is 07000 917 917. Send us a text or a WhatsApp message to 070 317 56537. That is the number to call. And of course, send us a text this morning on the program Radio Doctor, your free health consultation program, where real doctors advise real people. All right, so yes, of course, we have doctors as well with us, and we're looking at chlamydia, testing, treatment, and care. All right, Dr. Sazwa, are there home remedies or over-the-counter treatments for chlamydia in women, or we have to come to the hospital for this treatment? Hello, Dr. Sazwa, did you get me?
What are their home remedies?
Yes, I was asking if there are home remedies or over-the-counter treatment for chlamydia, or we have to come to the hospital for this treatment.
Home remedies. So there are sometimes the people are advocate for home test for chlamydia. But there's no home remedy. There's no home remedy for now. It's better for you to see a professional. There's probably gynecology or the medical that is key in managing sexual transmitted. There's nothing like home remedies for now. So it's not better, it's not good for someone who has taken some of this, applying all these shampoos or doing medication to so they are not or take any form of herbal medicine or this one Abalaba Health Remedy Center. They will not completely issue because they don't have the best and the understanding of SPI. So there's no home remedy.
Okay. All right, thank you for clarifying that. Now, are there any specific consideration for chlamydia testing and treatment in pregnant women? Are there, specifics for pregnant women that you would love to tell us about?
Okay, before I go into that one, I want to give you some information.
Okay.
I would say that basically, the bacteria usually spread through sexual activities. I would say that an infected male, the male that is affected has about 25% chance of getting sexual encounter or transmitting the infection to the infected female. So the male has a very high chance, about 25%. If the man is infected, it can easily transmit about 25% chance of transmitting the infection to the female. However, the mother to newborn is about 50 to 50% causing conjunctivitis, most cases, or pneumonia. So, for a mother who has chlamydia, the risk of the baby acquiring infection of the eye, which is conjunctivitis, is about 50 to 50%. And for them to have febrile illness, what's called pneumonia syndrome, eye infection of the lung, is about 10 to 20%. Let me also say that the incubation period, i.e., for the time the patient acquires the disease, so the manifestation of symptoms is about 1 to 3 weeks, which is referred to as the incubation period. Then 50% of males and 80% of females are asymptomatic. Infections may cause a lot of discharges as hepatitis men. Let me say that men, epidemiology, that infection of the epidemic in men younger than 35 years, about 5 to 10% of these women they develop pelvic inflammatory disease. About 10% of them, sometimes they end up having liver disease, which is called hepatitis, which is mainly referred to as high Cushing syndrome. Now, for a patient who has chlamydia, for instance, the risk of having co-infection with gonorrhea is also there. The 40% or 20% of men are co-infected. Patients that also have chlamydia, about 40% of them which are female, or 20% of them which are male, can also have gonorrhea. Now, patients also have higher frequency of what we call electritis, which is referred to as Richter's syndrome, and also sometimes they can also have what we call conjunctivitis. Let me also say that one of them, which is called the granular veneno, which is a form of Chlamydia trachomatis, are responsible for most of the genital ulcers that we see in typical countries. So patients with chlamydia also suffer from genital ulcer, and they have ulceration, which develop within 2 to 2 weeks after exposure to it. And then they have what we call prostatitis, they can have lymph node enlargement. Some of them can even have the leg swelling, which we refer to as elephantiasis. Something like complication is wide. Based on different things, they can also have leg swelling, which we refer to as elephantiasis. So my emphasis here is place more on what we call prevention rather than waiting for complications to come before we make a decision.
Okay. All right. Thank you so much, doctors, as well, for pointing that out. All right. So, just as we wrap this conversation up, doctors as well, what will be your final words on chlamydia testing and treatments? What would you want us to take home from this topic of discourse today?
Okay. So, to begin to round off, my final word is that most of these people exist. Let us be very clear. Let us say that there are a lot of quacks who also pretend to be treating STI, so we try to avoid them. The most important thing is to try to involve in risky sexual behavior. Let us live well. I used to tell my medical students that if you live well, you also enjoy well. Let us try and live well. Don't get engaged in sexual intercourse with a partner that you don't know. If you must use barrier methods or you will call oral sex to prevent the infection. Husband, stay with your wife. There is no joy playing around. Women, stay with your husband. There is no need playing around with other men because most of these men are high risk men. And for adolescents who are very vulnerable, who are rich, and they should try as much as possible to also ensure that, if they must have the use barrier method. It has also been found that no socioeconomic status also increases risk. So we believe that the government will do the issue to increase the social welfare of people and make the economy very pleasant for us, so that no social-economic environment which is our fund will be highly reduced. So we encourage people to live well. When you live well, you also enjoy well, and you also enjoy and live long. And you avoid chlamydia, you avoid gonorrhea, you avoid
Okay. All right. Thank you so much, doctors, as well, for being a part of our program today and for talking to us on chlamydia. Thank you so much. All right. Do have a great day and enjoy the rest of the week. Okay. All right, so that's it today on Radio Doctor, right here on Women Radio WFM 91.7. You have heard it from Dr. Osazua talking to us about chlamydia testing, treatment and care. All right, Women's Health on Radio Doctor today, supported by ACT Foundation. A very big thank you to our Radio Doctor for today, Dr. Ede Edopolo Osazua, a consultant obstetrician and gynecologist at St. Ives Family Hospital. All right, a very big thank you too for tuning in and listening to Radio Doctor. Join us again tomorrow at 10 a.m. where we'll bring you the program Radio Doctor, which is your first free consultation specialized health program that comes to you Mondays through Fridays at 10 a.m. right here on Women Radio WFM 91.7. A very big thank you to the producer of the program, Esther Laribe, and the executive producer, Tomo Kewole Shunaya. My name is Rose Yusuf Kaiser. Do stay tuned to Women Radio WFM 91.7. Good morning.
WFM 91.7.